You recording? Okay. This is my skills video for providing mouth care for a unconscious resident. First, I will knock, uh, greet my resident. Hi, Mr. Smith. My name is Lala. I will be your CNA today. I'm just providing you mouth care. I have explained our procedure. I will identify our resident by their bracelet or their face chart or their face sheet or chart. Once that is done, I will perform hand hygiene and I will provide for privacy. Once I have provided for privacy, um, I will raise the bed rails on this side as well as the other side of the bed. Then I would raise the bed up to about waist length for good body mechanics. And then I will lower the bed rail on the side that I will be working on. I will be working on this side. Um, Before anything, I'll make sure that I have a cup of water which is filled about 2/3 high with warm water. I will have all my supplies here on a clean washcloth, mouth or tongue swab, along with the mouth swabs, some medication or mouthwash, along with chapstick, and then also my face sheet, my washcloth, and then my basin. I will don my gloves. So because this is a unconscious resident and they are in the lateral position, I will face them towards me in a sideline position. Sideline position. Um, so I will roll my patient towards me, making sure that he is in a position where he doesn't roll back. If not, I will use a pillow to stabilize the back of our resident. I will place a towel underneath our resident's face. And then I will try to put the basin under our resident's chin, trying to catch any water coming from the mouth when I clean. Obviously, this is not a kidney basin, but in the field it will be a kidney basin. So that way the inner part of the basin will line up with our resident's mouth. I will take a tongue swab and I will open our resident's mouth. And this is what I will use to keep open our resident's mouth, as well as trying to keep the tongue in place so that way our resident doesn't choke. I will grab our swabs as well as our medicated mouthwash or regular mouthwash, as well as our water. I will first rinse our resident's mouth by dipping a sterile and clean swab into the warm water, using my tongue swab to hold open the mouth and keep the tongue in place. And I will scrub the inner surfaces of the cheeks, the teeth, as well as the tongue. And I will use as many swabs as needed to perform this action. Then I will take another sterile swab and I will dip it into our medicated mouthwash or regular mouthwash, drip off the excess medicine, and then go in and clean the teeth, around the teeth, the lower and the upper teeth. I will grab another swab, dip it in the medicine, drip off the excess medicine, and I will work the surfaces of the inside of the mouth as well as the top and the tongue. Apologize. The basin is still under our resident's mouth to catch any runoff. And then once that is done, I will take a clean washcloth and I will pat dry our resident's mouth. Put that to the side because it will go to dirty linen. Grab all my supplies, remove the basin, grab all my supplies and discard after my skill. And then I will take some chapstick and I will apply it to our resident's lips. Once that is done, then I will remove my gloves. And I will discard of the gloves. Oh, I apologize. I should have removed my towel as well before removing the gloves. So once everything is done, I will then reposition our resident back in, or back on his back so that he is in a comfortable position. I will recover him with the top linen sheet. I will make sure that the call light is within reach. I will raise my bed rail and then I will lower the bed to its lowest position. Once the bed is lowered, I will then lower the bed rails on the side that I'm working on. I will do the same on the other side. I will then perform hand hygiene and then I would record and report any observations to the nurse. Skill complete.